Thank you, Chip. Friends and family of two American missionaries stricken with Ebola say that they're improving slightly. Dr. Kent Brantley of Fort Worth has been at Emory University Hospital in Atlanta since Saturday. A statement from Samaritan's Purse says Dr. Brantley was given an experimental serum before returning to the U.S. It's the same serum that he asked doctors to give the other Ebola patient, Nancy Wright-Bull. She is expected to arrive in Atlanta tomorrow. She will also be treated at Emory University Hospital. Dr. Jeffrey Kahn is the chief of pediatric infectious diseases at UT Southwestern and joins us this morning. Thank you so much for being here, first of all. Yeah, some people are not happy that Dr. Kent Brantley was brought into the U.S. to be treated for Ebola. Why not, the disease is in Africa. Why not treat him and Nancy there?
Well, first of all, the risk of the Ebola virus spreading in the United States is actually quite low. Mm-hmm. We have all the necessary precautions in place, all the protective gear, so the chance of a healthcare provider or anybody else in the United States getting infected with Ebola with the transfer of this patient mm-hmm. is low. It's important to study this disease. Obviously, right now, the disease has spread to 3 countries in Africa. There's a big concern that the epidemic is going to spiral out of control. So there's a need to understand this disease. My anticipation is that they're going to be trying a number of experimental therapies on him, perhaps, studying the dynamics of the disease, how much the virus is spread, so on and so forth.
It seems like in the past when we see a disease in one part of the world, at some point it finally makes it to the U.S. Do you think that's the case here?
Well, hopefully this is not going to happen. But again, it's very concerning that the virus is spreading out of 3 countries in Africa.
Right.
And most likely that has occurred, well, through travel, maybe through ground travel, through air travel. And that's the big concern that the WHO and the NIH and the CDC have right now.
Right. No known cure. Ebola's killed more than 800 people in Africa. National Institutes of Health announced that it's starting this experimental testing, this Ebola vaccine, in people as early as September. I mean, how promising is that?
There are a number of Ebola vaccine candidates out there. Uh-huh. It's going to take a while to develop these vaccines. Obviously, they're very difficult to test in real practice. But this is the only way to stem these types of epidemics. Once it expands to this extent, this level, the most effective way, other than, of course, protective gear mm-hmm. and the types of infection control policies that we've seen, is to vaccinate individuals in the area to prevent the spread of the virus. Really,
the key is stopping it in Africa, and the CDC says that could be maybe 3 to 6 months. Is that what you're hearing?
That's the anticipation.
Right, is to get there in Africa and try to get rid of it before it goes anywhere else.
Right, they're now having a number of healthcare providers who are trained in this type of care, who are going over to Africa, a number of infectious disease specialists going over to Africa to try to stem the spread. The 3 countries where the virus is circulating right now may take some drastic measures as far as closing schools and limiting transportation. So these are the types of things that are required to stop the spread of this deadly disease.
Thank you so much for joining us. We appreciate it.
Thank you.